I'm Larry Weeks, and this is Bounce. On this podcast, I have conversations with people from a wide variety of fields. I talk with academics, athletes, entrepreneurs, doctors, journalists, and many others to try to get their stories or research on how to deal with or prepare for life's challenges, setbacks, aches and pains, and ups and downs. To that end, it's an interview format, long form. And despite the fact that I'm scratching my own itch, and even through my frequently dumb questions, the guests are game, they're very insightful and always encouraging. I'm learning a lot. I think you will too. This is life. Welcome to Bounce.
People often say, was it an advantage or a disadvantage to be a doctor? It was both at my first diagnosis. The focus of what my work is whatever your medical challenge, you can find an approach that helps you get good care and live as fully as possible. And I knew that the experience of being a patient would help me be a better doctor. It blurted out and shocked me when it came out of my mouth that I said, I'm usually good at things. Why can't I do cancer right? What did I do wrong? From a very deep subconscious part of me, I felt responsible for my illness.
Hello, everyone. Welcome to another episode of the Bounce Podcast. Today on the podcast, I'm privileged to have Dr. Wendy Harpham. Wendy is a doctor of internal medicine, fellow of the American College of Physicians. She's a best-selling author, patient advocate, and a nationally recognized speaker. At the age of 36, and as a mother of three with a busy solo practice in internal medicine, Wendy was diagnosed with stage 3 non-Hodgkin's lymphoma. Stage 3 meaning the cancer is in numerous places. Now, as a 26-year cancer survivor with 7 recurrences since, Dr. Harpham has a lot to say about surviving cancer, and that's what we're going to talk about today. Since her diagnosis, Wendy has played an important role in raising awareness among clinicians and empowering patients to talk with their healthcare team about the challenges of survivorship, such as post-treatment fatigue, raising healthy children when a parent has cancer, and participating in clinical trials. Dr. Harpham is a regular column in Oncology Times. View from the Other Side of the Stethoscope won the 2016 Eddie Award for serial articles in healthy, medical, and nursing. As I said, she's an author. She's written 6 books, Diagnosis Cancer, After Cancer, When a Parent Has Cancer, and the book that I read, Happiness in a Storm, Becky in the Worry Cup, and Only 10 Seconds to Care. So today we're going to talk about all of this, about her story, her experiences that informed the book, Happiness in a Storm. We do talk about all the emotional elements in dealing with cancer, but we focus on defining what she calls healthy survivorship. We're going to talk about the steps she recommends taking when first diagnosed, why educated patients do better, her perspective on the advantages and, to me, the surprising disadvantages of being a physician and dealing with such a diagnosis. We talk about how some patients actually find fulfillment and joy while others fall into bitterness or despair. I really enjoyed talking with her. I learned a lot, and even though this is a heavy topic, talking with her was very uplifting. I think you will agree. Let's talk to Wendy. Dr. Harpham, welcome to the show.
Good morning. Glad to be here.
Thank you so much. So you were not only a cancer survivor or are a cancer survivor, but you were a doctor of internal medicine and dealt with many, many patients who got the diagnosis and needed treatment for cancer. Is that right?
That would be right.
So how long did you keep practicing after your first diagnosis?
I'd been in practice for 7 years when I was first diagnosed. At that time, my 3 children were under 6 years old. And you're right, I went into my diagnosis with the perspective of a physician. So unlike the average patient who has little medical background, I understood what was happening. I understood the language, the vernacular, was able to communicate very effectively with my healthcare team. People often say, was it an advantage or a disadvantage to be a doctor? It was both at my first diagnosis, because on one hand, I was very comfortable in radiology suites, in operating rooms, in doctors' offices, and communicating. On the other hand, I didn't have that cloudiness of not knowing what the future would hold. I could picture in graphic detail all the possible outcomes, including the terrible ones, even if everyone did everything right. So I think I had less denial, or a lot of patients will come into it and say, I'm going to beat this and I know I'm going to be okay. At the same time, these people may be fearing dying. But for me, it was like, I know I can die from this, even if everybody does everything right. And I could picture patients I'd cared for who had unfortunate outcomes. So in the beginning, I think I had probably more anxiety than the average patient. But in the end, there's no question in my mind that my medical background, my ability to communicate, my knowledge of what I could do between visits to help optimize the outcome gave me advantage. And Larry, that's why I wrote my very first book. I wanted to give the average non-medical patient the advantage I had.
So I think that's interesting that you were talking about the disadvantage where you didn't have, I guess, the luxury of denial.
Not being able to picture terrible outcomes.
Yeah. So it clouded hope.
Right. And I knew in detail all the things that could go wrong, whereas I know that the average patient doesn't.
And you're stating that can be a benefit because it enables a patient to hope, which is key in maintaining some sort of positive mindset.
Positive mindset, and be able to take positive action. If you are knowledgeable about what to look for, what is a warning sign, how to respond, and also what is not a warning sign, then your knowledge helps you let go of unfounded fears. It lets you advocate for yourself when there is something that needs medical attention.
Got it. So let's back up. Just tell us your story. So you were a physician, you're practicing, and then you got sick.
What happened was I was 36 years old, and honestly, I had finally achieved that place I had worked for years to attain. I had a solo practice of internal medicine. My practice was very busy. It was very gratifying. I focused on patient education in my office because I really believe that educated patients do better medically, and they are actually easier to take care of because they know when to call, they know when not to call, they know how to communicate well. So it was after my birthday, and I had developed some enlarged lymph nodes in my groin, and then over the course of a week, we were evaluating it as an outpatient, but over the course of a week or two, they enlarged a lot, and they caused very severe pain. And I ended up getting admitted to the hospital for pain control and exploratory surgery, where I was diagnosed with a stage 3 indolent, which means slow-growing, non-Hodgkin's lymphoma. And this is a cancer of the lymph system that the good news is it's slow-growing, so it doesn't kill you quickly. But the bad news is that there are no known cures for this type of lymphoma. And even now, 27 years later, there still are no known cures for this type of lymphoma, but there are many more treatments now than there were back in 1990 when I was diagnosed. So I underwent a 6-month course of very cutting-edge, aggressive chemotherapy, which put the cancer into remission. And after a few months recovery, after completion of treatment, I reopened my practice. But just a few months after that, I had my first of what turned out to be 8 recurrences. And I closed my medical practice. During my next remission, I worked in another doctor's office, but again, it only lasted a few months before I needed more treatment. I ended up being patient number 15 in the first clinical trial of the first monoclonal antibody used in the treatment of cancer. That was at Stanford, and it gave me a partial remission. And then months later, when the remaining disease progressed, I entered another clinical trial, and I got a complete remission. After that, I did another, I think it was 9 months of chemotherapy for the recurrence after that. And then I did another clinical trial. I did off-label therapies. And as you mentioned in the introduction, after 9 separate courses of treatment, I had my last treatment 10 years ago, which says a lot. It says a lot about keep hoping, keep trying. You never know what the future holds in terms of new treatments. In the middle of all those years of in and out of treatment, I honestly expected to be in treatment for the rest of my life. And I expected my life expectancy not to be what it's been.
What was the expectancy?
When I was diagnosed in 1990, the median life expectancy for someone with my disease was about 7 years. And then when I ended up having 2 recurrences in as many years, my life expectancy narrowed to about 2 years. And that's when I entered the first clinical trial. And so it's now 24 years after that, and here I am. I am living with many after effects of all these treatments. I don't know if you can hear it, but I'm a little raspy. I'm just getting over yet another infection because all those treatments have depressed my immune system, and we're dealing with that. I have energy issues and other issues. But Larry, I love my life. I'm so grateful to be here and do what I can do. I don't think about what I can't do. I think about what I can do. I've learned to work around the limitations so that I can enjoy each day as much as possible.
That's great. Educate us real quickly on the stages.
It depends on the disease. Stage 3 or 4 lymphoma is a completely different picture than, say, stage 3 or 4 breast cancer or colon cancer. It depends on the disease. And for many of the blood cancers, even the most advanced stages are very curable and very treatable. But the focus of what my work is whatever your medical challenge, you can find an approach that helps you get good care and live as fully as possible. And this speaks to the idea of healthy survivorship. It's the subtitle of almost all my books, and it's in the subtitle of all my talks. As you know, a survivor is defined as from the moment of diagnosis and for the balance of life, a person diagnosed with cancer is a survivor. When I was diagnosed in 1990, patients with cancer were called cancer victims, which is a very disempowering term. Nowadays, we're all used to the word survivor. It's a normal, very comfortable term. But when I was diagnosed, it wasn't. It was still being argued, what should we call people with cancer? But I was lucky because the week after I was diagnosed, I got this flyer, or it was a booklet from the National Coalition for Cancer Survivorship that introduced me to this new term, survivor. And I adopted it immediately because it was so much more empowering and hopeful than cancer victim. The interesting thing is that over the months of my treatment and then my first recovery, I did have a problem with the word survivor because it says nothing about your quality of life. It says nothing about your role in your recovery and quality of life. For example, someone who wakes up every morning reveling in each day is a survivor. And someone who is curled up in bed, totally withdrawn from life due to fear of recurrence, due to uncontrolled pain, that they don't work with their doctors, that person is also a survivor. And I didn't want to just be a survivor. I wanted to thrive. And I sat down and I said, Well, what adjective would describe a survivor to be the kind of survivor I'm trying to be? And again, when I had children, I didn't just want to be a mother. I wanted to be a really loving, enhancing, positive life force for my children. I wanted to be a good mother. So what kind of survivor did I want to be? And when I thought about what kind of survivor takes steps to promote health and to promote loving life, the word just popped out, healthy. I want to be a healthy survivor. And I defined healthy survivor with two criteria. A healthy survivor is a survivor who gets good care and lives as fully as possible. What's beautiful about this term is that anyone with a medical challenge can be a healthy survivor because it is not dependent on biology or medical outcome. A healthy survivor is defined by how you live your life, what kind of care you get.
So, by the way, talking with you, you exude passion and life force and positivity. So, you're certainly more than a survivor. Just in my estimation, talking with you, it's obvious. But when you were first diagnosed, tell me about the evolution of your emotions. Like, what strong emotions did you feel when you were first diagnosed, and how did that change over time? I mean, you state at some point you knew you were able to be in the middle of cancer treatments and feel happy.
Right. And that speaks to the point of a lot of work revolves around how can we help people survive? And my point is, why survive if you don't like your life? Interestingly, the week of my diagnosis, when I learned that I was about to embark on 6 months of very intensive chemotherapy, and remember, 1990 was before we had these fancy supportive therapies like ports, which make, that device that's inserted in the chest to get chemo. I had to get needle sticks in my arms and hands every week. It was before what are called growth stimulating factors that support the immune system when it's bashed down by chemotherapy. So I knew it was risky treatment I was getting too. And I looked at my husband and I said, Ted, I am not going to wish away these 6 months. I am going to live as much as I can. And as a doctor, there was this added benefit of I would never choose to go to the other side of the stethoscope. But if that's where I found myself, I was going to get an education in illness and healing that would serve me well for the rest of my life as a doctor. And at that point, I was expecting and hoping to go through chemo, get cured, and get well and take care of patients again. And I knew that the experience of being a patient would help me be a better doctor. So from the start, there was a positive link to this tragedy in my life.
So you looked at it as an opportunity to learn.
An opportunity to learn. And throughout my illness, I have always almost had this dissociative thing, like as a patient, I might respond to something or think something or feel something. And then I'd go, wow, did you realize what you just thought? Did you realize what you just felt? Now you can understand patients better. And not only can you help patients with this insight, you can help doctors and nurses and allied health professionals with this insight find a way to help patients. I'll give you an example. As a doctor, I knew that my first and my second recurrence were not my fault. They were because I had a bad disease that came back despite making wise treatment decisions and getting good treatment. And yet, at a support group, the night I shared that I'd just been diagnosed with my recurrence, it blurted out and shocked me when it came out of my mouth that I said, I'm usually good at things. Why can't I do cancer right? What did I do wrong?
Oh, that's interesting.
And from a very deep subconscious part of me, I felt responsible for my illness from my recurrence.
Wow.
And that insight, again, it was one of those, wow, Wendy, do you realize what you just said? And I realized I could use that positively to help other patients.
Is that common?
Very common, very common. And I can say to clinicians, when your patients have setbacks, when they have recurrence, when treatment doesn't respond to good therapy, take a moment to reassure your patient, this is not your fault. This is something we knew could happen, even if everyone did everything right. That simple sentence can relieve or help relieve the burden of guilt.
You know, I was talking with Dr. David Burns a couple of weeks back on the podcast, who pioneered cognitive behavioral therapy, or was one of the early pioneers. He was talking about a lady that he was talking to, and we were talking about negative thoughts and that kind of thing, obviously, but she was diagnosed with cancer, and he said she became depressed. And obviously, when someone gets diagnosed with cancer, depression is probably common, and it's not a surprise. You're going to get sad. But he said that when he talked to her, it wasn't the diagnosis. And when he pressed her and he kept asking her what her thoughts were, what was going on, it was guilt. She was like, people who are dependent on me can no longer be dependent on me, or I'm not going to be a good mom, and which really surprised me. He says, Larry, her depression wasn't around the diagnosis so much as the ancillary things that she was heaping on herself on top of the cancer.
Right. And there are challenges you have to bear, you have to face. There are burdens you have to bear when you're ill. And my hope is that by presenting all the different forces that impact what you think and what you feel, you can relieve yourself of the burden of undeserved blame, of problems that are not real. And I had to separate, Wendy didn't cause this. The illness caused it, which I had nothing to do with causing. And you mentioned in the beginning that you heard a lot of passion in my voice. Where that passion comes from is I've had the luxury of time to learn a lot about illness and recovery. Many of the insights that helped me took years to figure out or to come to. And if I spend the time to find words that share that insight, I believe that someone else can benefit in 5 minutes from something that took me years to figure out. And that's my hope before I die, is to share as much as I can.
Yeah, I would encourage those that are facing such a diagnosis or related to or know someone who is to read your books. You presented the facts, but because you have actually gone through it, it wasn't pie in the sky, the methods or things that weren't in the field, if you will, right? Yeah, these were lived, and you've written about it. So let's say someone's listening to us in our conversation. They've just been diagnosed. What's the first thing that you would say to them?
Well, I always tailor it to the individual because there's no one magic thing that works for every single person. But presenting the idea that this is a hard time, there is no way to make this an easy time, but people are resilient, and people have walked this walk before you, can offer insights, advice, tips that will help you get through it as smoothly, as safely, as quickly as possible. The most important thing you can do when you're newly diagnosed is get good care. Make sure that the diagnosis is accurate, that you're comfortable with your care, and that you're focused on making wise treatment decisions that give you the best chance of the best possible outcome. Get help with everything else. Let other things fall to the side. The other thing I emphasize is that it won't always be this disruptive, frightening, stressful. When you go into it knowing that it won't always be this way, that helps you deal with it while it is intensely stressful. For me, I've learned through the course of my ins and outs of treatment that when I become aware of a new worrisome symptom, the interval between realizing I may have a problem and finding out if I do or don't is going to be a very stressful, uncertain, frightening time, and there's no way I can make it not. But I take comfort during that time in knowing that it'll be better when we make a diagnosis, whatever the news is. The other intensely stressful time is the time between making a diagnosis and deciding on a course of treatment. Knowing ahead of time that gathering information, getting second and third opinions, weighing the treatment options and making a decision is stressful helps me because I know it's going to be temporary. I know the stress will resolve once I make the treatment decision with my doctors.
Yeah, because I would assume, let's say you're going to check up and you've been in remission, and let's say there's a reoccurrence, but if you're giving that news, you may fall into a fog or...
Right. And again, that's where affirmations can be incredibly useful. Mine for dealing with recurrence is an illness, not a death sentence. Another is that when you're diagnosed with recurrence, you're not starting from square one, because when you dealt with illness the first time, you developed coping skills, you learned insights, developed affirmations, developed a support group that can help you through. So you're starting at a better point, you're better equipped to deal with recurrence than you are to deal with the very first shocking cancer diagnosis. That does not belittle the fact that recurrence in many ways is a more frightening diagnosis than a first diagnosis. And again, just saying that out front, recurrence is a scarier diagnosis, helps people understand why they're feeling the way they do and gather their strength to move forward in this situation. I talked about that blurry denial, I'm going to beat this thing, that many newly diagnosed patients will feel that I didn't feel because I was a doctor. People diagnosed with recurrence don't have that blurriness either. When you talk about chemo, it's not just this vague thing of chemo. They remember what it was like to be sick from their prior chemo or their prior radiation or their prior surgery. So there's a lot more to deal with in terms of graphic images. The other thing is, in general, the prognosis is worse after a recurrence than it is after a first diagnosis. And so that's very frightening. Knowing that helps you deal with what you're feeling, but you can add to that equation. There oftentimes are newer therapies that are more effective after you're diagnosed with your recurrence than when you were first diagnosed. That certainly was the case for me. My last 7 courses of treatment were not options, Larry, when I was first diagnosed in 1990.
As far as treatments go, you state in the book that treatments can make you weaker, but they can make you stronger. They can make you unhealthy. They can make you healthier. And we're talking about in the long run. What do you mean by that?
Everything in survivorship is individual. In my case, I was a bit of a health mess before my diagnosis. My entire family kind of did a whiplash head turn when I was the one diagnosed. It's like, Wendy was the one who was diagnosed with cancer, because I exercised, ideal weight, low cholesterol, excellent blood pressure, ate healthy, all of that. And for somebody who's diagnosed when they are a couch potato, maybe they smoke, maybe they drink, maybe they just have a basically unhealthy lifestyle, their illness diagnosis can be a wake-up call to turn their life around that way. So in terms of behavioral modification, you can end up better than you were before. In terms of the practical, and let's go back to cancer, many cancer treatments have after effects, meaning they change the body either temporarily for a long time or permanently. And in that sense, it can make your body weaker. That's been the case for me after all the treatments I've had. My energy never returned to what would be normal for a woman my age. I had menopause at 36 years old. My blood counts, my immune system has been permanently damaged by my treatments. So my risk of infection is higher, that sort of thing. In that sense, my body is weaker than it used to be. And that's the price I paid for my survival. In terms of being stronger, there's no question that my insights, my facing my mortality, my experiencing the love and support of family, friends, my healthcare team has enhanced my joie de vivre, my love of life, my love of living. And it's also shown me my strengths. I am stronger than I ever thought I was. And many people will say, I didn't know I had it in me. I didn't know that I could do that. And my hope is that by educating people, showing them what they can do in situations of illness, helping them accept what they can't do, they will focus on their strengths and not beat themselves up over their weaknesses. And they will build strength.
So you advocate for treatment, chemotherapy, whatever the diagnosis or the disease may call for, you advocate treatment, but you belabor the point about the body doing the healing. Why?
Right. To give you an example, many people, let's say you have pneumonia. Many people assume that the antibiotics are what cures your pneumonia. My perspective is that the antibiotics are a tool to help your body cure the pneumonia. Certain types of pneumonia can be overwhelming, and the body's self-healing potential is not strong enough to cure the pneumonia, which is why so many people died of pneumonia before the mid-1900s when we developed antibiotics. The antibiotics will kill much of the bacteria that is threatening the person's health and life, but then it is the person's immune system that clears out all those dead bacteria, and that clears out the pneumonia and finishes all the healing. Why that concept is, or I'll give you another example. It's a little gruesome. I hope that's okay.
No, that's fine.
But if I do a deep cut in someone that goes through the skin and tendons, a surgeon can sew it up, and then the body will help heal it so that you have a scar and a functioning whatever it was. If you do that exact same deep incision in someone who's already died, and stitch it up, there will be no healing, because it is a living human being that heals wounds, heals infections, heals from injuries and illnesses. Why that concept is important to me is that when people feel like the treatment cures them and it's not their own body, they can feel passive and powerless, totally dependent on the treatment. In contrast, if they see the intervention, be it surgery, radiation, chemo, antibiotics, whatever it is, if they see those as tools, as aids to their own self-healing body, then they will feel more empowered. They will, in general, pay more attention to all the other factors that help the body heal. Nutrition, adequate sleep, circulation, which is enhanced through exercise of some sort. All the factors that help the body heal itself. My concern is always when people think the mind can heal the body, that people can will themselves well. the body has self-healing potential, but it has limits. And respecting those limits, doing what you can to expand those limits through science-based therapies, to me, is the key to getting good care and living as fully as possible. So while I did do the chemo, I did do the radiation, I did do the clinical trials, I also put my energy into exercising as much as I could. Larry, when I was doing my initial chemo, sometimes that exercise was 10 minutes looking like a 90-year-old woman on a stair stepper. But I did my 10 minutes to do what I could do. It was eating when I had no appetite, because my image was of the chemo helping my body get rid of the cancer. And I felt empowered to do my part through eating nutrition shakes when I literally was so nauseated I could not chew food and swallow food. As I said, the stair stepper, praying, being with other people, laughing, all these supportive therapies helped my body get in a healing mode to deal with the challenge of my cancer. Do I think laughter cures my cancer? No. Do I think that the milkshakes cured my cancer? No. But it gave me an edge. It was one more factor in my favor.
Yeah, it's a synergy, right?
It's a synergy. Plus, it helped me feel better while I was trying to get better.
What are your thoughts on vitamins, since we're on the subject?
Well, there's a lot of talk about supplements. We're all trying to do the same thing. When people take vitamins or take supplements or take chemo or take radiation, it's all to the end of trying to get better. And my thought as a scientist is always, you feel like you're helping yourself, but are you really helping yourself? And there are studies, good studies about high-dose vitamin supplementations or antioxidant supplements that don't bear out that they help. And in some cases, they hurt. So don't try to help yourself get better doing something that, in fact, may not be helping or may be hurting.
Do your research.
Do your research. Talk with your doctors. Now, unfortunately, a lot of conventionally trained doctors are not very well informed about all these different supplements, although that's getting better. There is an Office of Integrative Medicine. We're doing more studies to prove, using the scientific method, whether supplements do or don't help. In general, getting vitamins from food as opposed to from a pill is a better way to go.
And we're talking about ways one can help their body to heal. I thought it was a great heuristic that you talked about sleep, and you said in the book, insomnia, difficulty falling asleep or staying asleep, is a symptom like bleeding or vomiting. Right.
And sleep, I'm happy to see there's a lot of media attention to sleep lately. Sleep is very restorative. It's still quite mysterious. We don't quite know how it helps the body restore itself after the stresses of the day. But the fact that sleep is so universal and that we clearly don't think as well or feel as well when we're sleep deprived tells us that sleep is an important restorative factor in healing. So to me, if you're not sleeping well, if you're not falling asleep or staying asleep, having deep sleep, if you're having nightmares, that is a symptom that needs to be reported to your physicians and nurses and addressed.
Yeah, you said don't accept it because some people, I think you say in the book, that just think, oh, this is probably common. I'm just not going to get sleep. Or
Right. And to me, paying attention to all these factors, be it eating, sleeping, getting some exercise, feeling happy, feeling hopeful, all those things deserve medical attention. Many times there are medical conditions interfering with sleep. Maybe somebody's bladder is not working properly, and so they're getting up 4 times to go to the bathroom. That needs to be addressed to help them sleep. If somebody is so terrified of their diagnosis or feeling existential angst that they're being punished by their God, and that's keeping them up at night, that is a problem that can and should be addressed for overall health. And I keep talking about both getting good care and living as fully as possible. They are both important. You don't want to put your life on hold while you're going through treatment. I come back to what I said at the beginning of the interview when I looked at my husband and I said, I'm not going to wish these 6 months away, these 6 months of chemotherapy, because these 6 months are part of my life too. If anything, my illness has taught me to live in the moment because of my heightened awareness of the uncertainty of life. I realized that cancer didn't make my life uncertain. Cancer simply exposed the uncertainty of my life. And hyper-awareness of the uncertainty can take away your quality of life if you're anxious all the time, if you're always worried about what's going to happen tomorrow, worried about the other shoe going to fall, or, and this is what I have strived for since my diagnosis, you can use that heightened awareness of the uncertainty to enhance your life. My awareness that I could detect, I could take a shower tonight and feel a new lymph node in my armpit, which has happened in the past. That could either freak me out and make me not want to do anything today, make me anxious today, or it can make me say, I have today. I am going to savor today.
You had a great line in the book. And by the way, I failed to mention, but the one I read was Happiness in a Storm. And you talk about a triumphant life. And when I read it, I said, how can someone with a terminal illness achieve that? And different than, I understand survivorship and coping but the word triumphant kind of stood up. But then I read on and you elaborated where you stated it's how long someone lives, but how one lives.
And here's the thing. Very few people choose to get cancer or choose to be ill or choose to have their life derailed by some unwanted tragedy. And in life, to me, triumph is measured by how you respond to the unwanted challenges and to the tragedies in your life. And you do get to choose how you respond. That said, it's not like I can say, oh, I'm going to be hopeful. I'm going to be happy in my situation. You need to learn how to deal with the challenges, learn how to develop your strengths. I often talk about if tears cured cancer, I wouldn't have needed chemo because I cried a lot before to grieve all my losses, the loss of my health, the loss of my practice, the loss of my dream of being a clinician, the loss of my energy, the loss of my sharpness. I had to grieve my losses to see what remained and then to embrace the life I had. So it's not a snap of the finger. You choose to love your life or you choose to accept the uncertainty and voila, there you are. You can do it. It is work. It takes time. It takes education. It takes effort. It takes failures. It takes learning. It takes developing habits. It takes time. And I repeat, one of the prime motivators of my writing every day is that many of the insights that help me so much took me years to develop or to come to. But once I had them, they helped me quickly. And I try to give it to other patients on a silver platter.
Real quickly, we were talking about ways one can help the body to heal. What is your opinion of meditation, specifically like mindfulness meditation?
Right. My hesitation is that I'm what I call a horse, a racehorse. My way to relax is to walk quickly on the treadmill or to write extra hard. I'm somebody who's always going, going, going. That's my comfort zone. I have been reading more and more about mindfulness, meditation, yoga, and I keep saying I need to stop and do that because I'm becoming increasingly convinced of the health benefits of stopping, of coming to peace. And in fact, there's a new book out called Attending by Ronald Epstein. That is a marvelous book about mindfulness. But I do believe that meditation, mindfulness are grounding. They are healing. And while I describe myself as a racehorse who's always going, 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 I do pray. And when I get into bed, I do focus on my breathing, take deep, slow breaths to go to sleep. So while it's not a formal yoga or meditation, that sort of thing, clearly I have incorporated that stopping mindfulness in my life.
Yeah, I've talked on these interviews with many people, and it seems over and over again, everyone is doing something. It may not be a formal practice of sitting down, being still and thinking, but they're either, I'm hearing that they're running or they take a walk. There's something where they're pausing, and it may be active pausing, right? Where they're walking or running or doing something that just focuses the mind elsewhere or takes the mind off of the stresses of the day or in life or what have you, and has the mind attending to something else other than the problems or their issues or what have you. I hear that more, I hear that often, where they may not have this formal meditation practice, but they're doing something that puts them in some kind of flow.
Right. And earlier you asked about how does treatment or illness make you weaker and make you stronger. The unexpected dramatic change in your life can be an unsettling opportunity to learn new ways to live your life, including new ways to regain and maintain health, such as incorporating mindfulness in a way that you never would have had you never been sick, or focusing on your nutrition, focusing on trying to get exercise, whatever it may be, focusing on your sleep that you neglected, that you just kept drinking coffee all day long and then didn't sleep well during the night. It's an opportunity to change how you live your life.
Mm-hmm. I love a statement you have in your book. You say philosophy, spirituality, and love are the glue that holds your life together in hard times. What is your definition of spirituality? You say you pray.
Spirituality is different than religion. Spirituality is an awareness of the mystery of life. It speaks to questions of purpose. Why am I here? What am I supposed to do with my life? I was raised in the Jewish faith, and my spiritual and religious faith both became much stronger after my diagnosis. My rabbi came to my house to pray with me and explore with me. During my initial chemotherapy, we read the book of Job together. And I remember the first couple of weeks, I'd say, what if I die? What if I die? Because I had 3 young kids at home and a husband who was my best friend, my lover, my everything. And I just dreaded the idea of possibly dying and leaving them. And after a couple of weeks of talking about, what if I die? What if I die? I went, what if I live? What am I supposed to do with my life? And that was an equally important question for me.
You think feeling sorry for yourself in this condition is dangerous. Why do you say that?
Self-pity, feeling bad for yourself, is a very disempowering emotion. Now, I do believe in what a lot of people call pity parties, as long as they're very limited in time and scope. If you get bad news, if you land on the bad side of what should have been good statistics, I think saying, wow, this just is lousy. This is just not fair. I don't deserve this, having a little party for yourself that way, that's okay. But if it continues, that's not helping you get good care or live as fully as possible. That's making you the victim. In contrast, saying, well, 3% of people have this complication, and whoop, I'm in the 3%. It's life. Okay, what am I going to do now? For me, it's always, what am I going to do now? And the other side of it, Larry, interestingly, many of the insights I had that helped me were outgrowths of my impassioned efforts to help my children through my illness. They were 1, 3, and 5 when I was diagnosed. I wanted them to grow up as healthy and happy as possible. I knew I couldn't protect them from the challenge of our family illness. And so I tried to present the challenges, the uncertainty, the disappointments in as healthy a way as possible, so that they would grow up healthy. And one of them was that I would never feel sorry for my kids. Look, this was life. This is what happened to our family. What are we going to do now? So, for example, if I had a recurrence when they were supposed to have their birthday party and we ended up having to delay their birthday party, if I felt sorry for them, if I pitied them, then they would feel bad for themselves. They would feel like the world was unfair and things were terrible. I could acknowledge that it was disappointing and upsetting, but then I could focus on, okay, what are we going to do instead? How are we going to celebrate instead? Kids can have a harder time with delayed gratification. Well, we'll do it in 6 months. Boy, that's no fun. So what could we do instead to celebrate, since we couldn't celebrate the way we planned? And my family ended up doing a lot of very fun things that we would never have chosen had I not been sick, but that were genuinely fun. I remember when I went through all this parenting early in my illness, I would say, only time will tell if my approach is working for them. My children are now 28, 30, and 32, and it is gratifying to see how when something goes wrong, they just accept, well, that's life. You can do everything right and things can go wrong. That's life. So they don't blame themselves. They don't feel like they were not good enough. They just know that life sometimes doesn't work out right. But they are always saying, okay, what do we do now? Or they'll say, well, what good thing can come out of this situation that didn't work out the way I wanted?
I love this question. I've underlined it in the book. You, in referring to the rabbi, and you're saying, what if I die? And then you ask yourself, well, what if I live? And I love this question. You say, how much do you want to feel happy? How much effort are you willing to put in, and how much are you willing to change in order to be happy? Right.
And that's a paradigm change for a lot of people. They think that happiness is just something that happens if everything's working out okay, and if there are no crises going on, then happiness emerges. What I learned as a patient is that happiness can be hard work, especially if you're dealing with chronic illness or serious illness or a very grim prognosis. Happiness can be hard work, but it is possible. Knowing it's possible is the start. Some happiness happens because of the illness. And you say, well, what happiness could happen because of the illness? When I finished treatment, being relieved of the visits and the needle sticks and everything, that was a very happy moment that wouldn't have happened if it weren't for having gone through my illness. An even more powerful happiness is you have your post-treatment scans and visits and tests, and you learn that your cancer is gone, that you're in remission. That is a glorious moment, an indescribable moment that wouldn't have happened if I hadn't been sick. But there are the more ordinary moments, too, that are happiness because of the illness. When I entered the first clinical trial, my husband and I was treated at Stanford. My husband and I went to Muir Woods. Walking those quiet paths, being very aware of what we were walking into, the uncertainty, not knowing if this was the beginning of the end for me. The power of the love between me and my husband at that moment, I don't have the words, but it was a beautiful moment. I'll always remember that happened because of my illness. I did not have an appetite for the first couple of years of my illness because of my disease and my treatments. And I've had a great appetite since. Every time I sit down to a meal and I feel hungry, even today, 24 years after the first trial, when I feel hungry, I go, wow, that's a wonderful feeling. I'm so grateful to experience hunger, to be able to taste my food. Something that's very ordinary, but has become extraordinary. And that is a happiness in my life because of the challenge of my illness.
Wow. Dr. Harpham, this has been great to hear your story, what you've gone through, how you've dealt with it, and then coming from the perspective of a physician is very eye-opening. As we kind of wrap this up, I just wanted to ask you what's happening now in the field of cancer research?
Well, one of the phrases I like to say is there are no incurable diseases. The textbooks will still call my type of cancer incurable. There are no incurable diseases. There are only diseases for which researchers are looking for cures. And that's why I work so hard. One of my advocacy efforts is to raise awareness and funding for cancer research. The other closing message I'd like to share with your listeners is that none of this is easy. Yes, I'm passionate. Yes, I love my life. But it was hard work. It took learning. It took trials and errors in approaches. I tried this, I tried that. It took a lot of asking for and accepting support. It took setbacks. People often talk of cancer or illness as a roller coaster. It is a roller coaster, especially at the beginning. But the hopeful message is that you can learn about your illness, about your treatment options, about coping styles, so that you can find an approach that works for you. You can learn what you need to know to communicate well with your healthcare team, to feel confident that you're getting good medical care. You can learn what you need to know to gather around a support system, not just through the crisis of a new diagnosis, but through the long-term recovery and life after completion of treatment. You can learn what you need to know to grow stronger through the unwanted challenge. Everyone is different. There is no 1, 2, 3 for everybody, but there's no best choice or best approach for everybody. But there is a best approach for you and for your friend and for me and for my sister. There is a best approach for each individual. It's an approach that will change over time as the circumstances change and as the person grows.
I just wanted to state that you have a Harpham decision tool, which is a unique chart for helping someone decide on the best course of treatment.
And in the book, Happiness in a Storm, in addition to printing off the decision tool that people can just photocopy or rip the page out of the book, it does have an explanation of how to use the tool to help them get information and to make the best decision for them. Interestingly, if 10 different people had the exact same disease and the exact same prognosis and filled in the boxes, different people would come to a different treatment decision because the best treatment decision reflects full understanding of your options and then making a decision in keeping with your values.
Is that tool online on your website or anywhere?
I don't think it's on my website, but after this phone call, I will probably put it on my website.
I'd put it there. You could also get a developer to do some scripting, and somebody could online use the tool. In other words, input their information and you could output it there on your site. But we could talk about it.
That's wonderful. That's a wonderful idea. I will take you up on that.
So let's talk about your website. Where do people find you?
WendyHarpham.com. WendyHarpham.com. And I have a blog on healthy survivorship, which is another one of my passions. I keep each post less than 250 words, which means it's just 30 seconds of reading. And every post deals with either getting good care or living as fully as possible. I respond to articles that are in the news. I do book reviews on it, personal experiences. It's all about getting good care and living as fully as possible.
That's great. Are you on the socials? Facebook, Twitter?
Facebook, Twitter, of course.
Dr. Harpham, this has been a great conversation. You've been so gracious to share all this. Thank you for, like I said, writing the book and agreeing to come on and talk about this.
And Larry, I appreciate you doing this series to help patients get good care and live as fully as possible. It's a shared mission.
Yes. I can't wait to let my friends who have been diagnosed and kind of gone through this multiple times to hear this conversation. I think they'll benefit greatly from it. But I can't imagine what the recognition must be from somebody going through this and just hearing someone else talk about it. You know what I mean? Just that shared experience.
Well, this is me just passing it forward because throughout my illness, I have received superb medical care, compassionate expert care, and I have received loving, endless support from my husband, now my grown children, my circle of friends. People have been wonderful to me. I credit them with helping me through my survivorship, and this is me just paying it forward.
Well, that is all the time we have today. Please spread the word if you enjoyed the episode. Leave us a review on iTunes and share it with your friends